Hello, everybody, and welcome back to the Dr. Mike and Shannon Show. I'm Shannon Fanenstein, medical technology specialist with Mazan Medical. I'm here with Dr. Mike. Dr. Mike, want to briefly introduce yourself for those who are new to the show?
Sure. Dr. Mike Bradley. I'm a PhD. I work with the Mazan Medical as their chief medical officer. I work with several of the gynecology, urology offices here in Las Vegas, Nevada, and the School of Medicine, UNLV Medical School, and researching women's pelvic health. That's what I do.
Thank you. And today's question. So I know it's definitely time for me to get my Botox on my face. I'm a little past due. I think you know where I'm going. I have heard that you can actually get Botox down there. So it doesn't do, however, what I thought it would do. So can you explain what the Botox down there actually does?
Yes. I think it's a great question. And I'm sure, number one, if you've been directed that that's something that you need, you have an understanding that, oh, that's interesting that it can be used in two different parts of the body. If you've never had it done before, you may not necessarily have that particular issue that requires it. So when we use Botox, or what was it, botulinum toxin, right? To go into our nerves in our face, is designed to kind of smooth out those wrinkle lines, and it makes it impossible for us to be able to go up and down and make those wrinkles more visible, allowing the skin to just kind of flatten out. And it's a nice aesthetic procedure. It lasts 6 to 12 months and really calms that face down, right?
Frozen face. We're expressionless.
Frozen face, and a frozen face will lay down after a period of time. And that's kind of the whole mindset. But what we do down there is, interestingly enough, is in the bladder area that calms that part of our body down the same as it calms the front of our face down, if you will. When we inject Botox, it basically helps stop these neurotransmitters that come out from our bladder, telling our mind that, oh, it's time to use the bathroom. So a lot of people that have something called urinary frequency, where they're going to the bathroom every 5 seconds or getting up at night to the bathroom, more than they should. When they go and sit down and pee, they're not actually peeing like a lot. They're peeing a little bit. They just keep going every 5 minutes. Well, that could be because your body is producing these neurotransmitters to your brain, telling you even before it's time that, oh, you need to go to the bathroom, even though you sit down and nothing comes out, right? Or very little comes out. So the Botox, the toxin that we inject, it basically blocks those neuro receptors from telling your brain that it's time to go to the bathroom, when guess what? It really isn't. So it calms an overactive bladder, just like an overactive face, down.
I could not imagine working in those conditions of having to go. I mean, it's bad enough when I have to go, I have to run now to the bathroom, but doing it that frequency, I mean, that would be not only stressful, but just debilitating.
It's one of those things where, so we know that one of the biggest killers of people, and this might surprise you, they have determined that the biggest killer of people, period, is a lack of sleep, right? The biggest killer, period, is a lack of sleep.
Because highest death rate, yes.
And it affects everything else in our body. And right behind it, for our elderly, people over 65, one of the biggest killers for them is falls. But you know where those falls are occurring? When they're getting up at night to go back and forth from the bathroom 7 or 8 times.
And I worked in trauma. I can attest to that. Yep. A lot of hip nails for me.
And statistically speaking, if you have a major injury after a fall and you're over a certain age, there's an 80% probability you're not going to be here after 1 year. So that's a pretty big, thing. So when we have people that suffer from urinary frequency, it's super important to take that very seriously, especially our elderly. And the idea of something like Botox to calm it down makes a lot of sense. It gives you 6 months to a year of relief. Now, I can't say that without also saying that it depends on the patient. So we talk a lot about on our channel the bulba cavernosa reflex and that system of testing those pedonal nerves down there, the sacral nerves down there. Well, there's a study, a really great study out there that has determined that if you do a bulba cavernosa reflex test and your latency is greater than 100 milliseconds, Botox will not work for you. It will not get you dry. It will not be successful. So we've got a test that before you start injecting yourself with botulism toxin, right? The type A, I think.
An area you may not necessarily be looking at
Right.
and see the difference.
Yeah, it's whatever your doctor is suggesting, you know, and we recommend you go with what your doctor suggests. But that being said, it makes an awful lot of sense to, before you do that, to test those nerves to see if that's what's causing the urgency and frequency or not. I also recommend
a very good point, because if I'm being injected with that and I'm over that threshold, I'm not seeing a result, how much more frustrated as a patient am I going to be? Or how much am I going to now, trust the next step that the, provider is telling me to do? Well, this is what you told me would work, and now it's not working.
One of the greatest tools that any provider has is the ability to predict outcomes, right? That develops trust between us and the doctor that gave us that information or that treatment, right? And a lot of times providers forget that the ability to diagnose in every possible way is our key to being able to determine treatments that will work. We'll have 5 different options we can give a patient, and we usually do it based on experience. But if we have the opportunity to get true objective information that takes away 2 of those 5 choices that wouldn't be successful, that makes us more likely to find, of the 3 that would, something that will actually work for you, increasing your trust in us to help, get you to that point that you're trying to be. So now I only have to try 3 different things that are going to work instead of 5 different things, 2 of which might be a complete and total guess and end up not working for you. And then what happens to a lot of patients? They get frustrated. They don't look for another provider. They just live with it. And then before you know it.
Yeah. And the nice thing is, during this treatment process, there is a way to see what is working and what's not working by being able to have the screening done again.
Yeah, that's right. So after you've done the treatment, you can do another bulba cavernosa reflex, test, and confirm that that nerve has calmed down or even, got a better reflex time. It's very powerful, very useful. It's good information. And it's information that up until recently, providers weren't really able to get access to. That's why a lot of people don't know about it. It's the new mousetrap, if you will.
Well, and I thank you for your time, and I thank you for shedding the light on, what the Botox for down there is and what it does. Because if somebody were to say to me, oh, you need Botox there, I would look at them like I'm crazy, like they're crazy, because it's not what I thought. And I'm sure it's not what most of our viewers thought it was. But if you are a provider and you would like more information about the Urival BRS screening for being able to do it with your patients, we would be more than happy to be able to share that information with you. There is a link down in the description below, and that way you can get more information. And if you are watching this, please make sure that you like and subscribe. And we thank you so much for your time today. And thank you again for watching.
It was absolutely my pleasure. I'll try to make sure I post the links to the articles that I referenced as well, just so you have that information that I have.
Great. Thanks again, Dr. Mike.
Thank you.